Hello friends, myself Dr. NEUROLOGICAL. Welcome to this exclusive program. Friends, as we all know that neurological rehabilitation is a big challenge for all of us when we are treating as a doctor, and it really becomes pathetic for the patients. They keep on waiting for prolonged period of time, and they are not getting most of the time very good results, and they live the dependent life most of the time. So why this happens, why patients do not become normal, what's the reason behind it, why there is a spasticity, why there is a dependency. So many questions are there, and every one of us face such kind of questions. To get the answer to this question, we have designed this program that is based on Vasa concept. Friends, today and tomorrow, there will be a case presentation by individual cases who recovered from the Vasa concept treatment. So we will be able to know that what wrong they were doing previously, which we might be doing right now with our patients also, and what change they got after starting the Vasa concept treatment, and how they started recovering, and now what are their status. So the entire idea is to get an idea about what is going wrong in our management as far as the neuro rehabilitation is concerned, whether it is for a pediatric patients or whether it is for the adult neuro rehabilitation is concerned. So the thing is that we come to know about what's going wrong in our practice so far and how we can change it. That we will learn in 8th and 9th August program with Mari from Finland. She will teach us about thoroughly the scientific aspect of the Vasa concept. So during this presentation of the patients, if you are having any questions, you can write down questions in the chat group. If you are having questions related to the medical profession, then keep those questions written into your phone or in your notepad. So you can ask these questions to Mari on 8th and 9th of the August when she will take the lectures on the Vasa concept. But I can assure you that this is a wonderful concept. We at Spinex are treating our neurological patients with this concept, and we are getting immense result for last 3 years. And this is a phenomenal concept. That's why I am insisting every physio to learn this concept and to adopt this, to understand this, and to implement this concept if possible. And if you are convinced to your patients, that will, I am very sure, will change the way you are practicing right now and the way patients are recovering right now. You will feel a lot of difference. So before not taking your much time now, I would like to start the presentation. There is Milind with me and Abhijit with me. They will also assist me to ask the questions whenever it is required to ask to the people who came out from this neurological disorders. And let us see, we will start with the patients. Yeah, Milind bhai, please come. Yeah.
So we have Mrs. Padmashali who is going to start right now. First one.
Please ma'am, yes. आप हिंदी और इंग्लिश कोई भी लैंग्वेज में बोल सकते हैं. Language is not a bar. The main purpose is this event is that you convey your message thoroughly so everyone can understand about the problem you are facing and how you came out from it. Okay, please.
Okay. Thank you, sir. Good evening, all. This is Sheetal Padmashali, the mother of Shreyas Padmashali. I'm here to share my experiences after accident we had in 2011 and how Vasa concept has proven a blessings to us. Shreyas was a normal child, enjoying his life, school life, and his daily routines. Like a 6-year-old child, all his activities were on. Like every day, we have gone for a vacation, summer vacation, and while on our journey back, we had an accident in the city of Mangalore, where this 6-year-old child, we three of us were there, myself, Shreyas, and Shreyas' father. All three of us got injured, but Shreyas was injured the most with the severe head injury, right side portion of skull into pieces, then brain protruding out. His spinal cord had a major injury. His lower jaw dislocated. Uh, with such condition, Shreyas was admitted to the hospital immediately after accident. He was in a very critical condition. Even the doctor was not having any hope for his survival. He was on an incubator for 8 days, and then 15 days he was in ICU. Soon, gradually, he started responding, and like when his condition was stable, like we had shifted from Mangalore to our hometown. Actually, when I saw first time Shreyas after the accident, it was like shattering for me to see only son, 6-year-old, surrounded with all PCs and computer machines with all wires and all needles pricking in his body. He was just lying idle on bed, motionless. In this, as soon as his condition got stable, like we shifted from Mangalore to Mumbai, our hometown, where he got hospitalized, admitted to very well-known hospital in Mumbai. In that time also, he was having the IV pad. He was on RT feeding. He was not able to speak. In fact, he was not even able to recognize any of us. He was, because of trauma. He was in temporary memory loss, and plus IV pad was there because he was in continuous urine infection. IV pad was there. He was on water bed. He was hospitalized there in Mumbai for 2 months. The routine was going on, like as soon as we enter the hospital, all the procedures were done again, the CT scan, MRI, all the things, to just see whether his condition is changed during the traveling. And he got admitted, and he was there for 2 months. Like for after admission, like we had this accident in 23rd March 2011. We got admitted here in Mumbai in month of April. Like first few weeks, like the routine was on. The doctors and nurses used to come. They used to check Shreyas and give the time. RT feeding used to given on fixed timings, this that. Nothing much was happening at that stage itself. Exercises were going on. That means like just hands and legs were moved by the physiotherapist who used to come in the hospital in the sleeping position only. Shreyas was, though he was conscious, but he was speechless. He was neither recognizing any of us, just like it is just a moving body lying on a bed. He was on water bed that time. After a few days, like the days were going on like that, and with no improvement from Shreyas side in terms of the memory recovery. Like when we got discharged from the first hospital after 23 days, I still remember the words that doctor told me there. The accident was very severe. So whatever the thing is happened to him, we had tried our level best, but how much Shreyas will remember, when he will remember, it's in God's hand. We tried our level best to do best possible treatment to him. So keep trying, pray to God, never lose hopes, but don't over expect, because his injuries were so severe, he could not predict that time the recovery of patient. In this condition, like we were in the Mumbai hospital. These thoughts were in mind. I kept trying, though Shreyas was not recognizing me, any of us in the family. The whole day I used to sit with him, showing him his favorite toys, telling him stories. Somewhere he will recognize us, so that he can also identify us and start responding. So one fine day, after having so much of struggle, like after 1.5 months, finally I could hear the word from him, Mama. Finally he identified me. we were so happy that day after the struggle of 1.5 months that at least his identity is back. Then our real struggle battle started now for his improvement. We thought we have to take his improvement now more aggressively. So we were in continuous touch with doctors, asking them how we can remove his RT and how he can be able to, take food intake normally. First, doctors were very reluctant to do so because, yes, of course, the condition he has come from such a critical condition. They were got afraid of, they might the if we try to feed him from the mouth, like the food or the liquid might go to lungs, then he will have a breathing problem or choke up problem. So, like, first of all, we were in traumatic condition, and instead of support, like, we got such kind of replies from the doctor. But still, we had a firm decision. We convinced them, at least we'll try. You are there with us in the hospital, so if anything goes wrong, we can tackle it out together. So because of our insist, they very reluctantly, but they started the allowed us to feed Shreyas with the spoon. We literally started with 2 spoons of water to feed Shreyas. He responded well. Slowly, we gradually increased the liquid intake, then moved to the semi-solid and then solid. And luckily, the RT got removed. He could eat his food orally. Same thing we insisted for the urine tube also, because all the time he had a urine infection, urine bag was there. So on our this thing insistence, again doctor tried twice, to remove the urine bag, and unfortunately Shreyas could not pass the urine out even after waiting for 8 hours. We were a bit disappointed, but it's okay, some improvement was going on, so we were satisfied. But one fine day, with God's grace, the urine tube came out of its own only, and it was Sunday night, no doctor was available. So, like, sister on the duty told to keep him on diaper, and we were so lucky that next day morning we opened the diaper, it was wet. So at least he had started passing the urine as a part of improvement. So we decided now it's a time to get him discharged. During the discharge also, we had been given the list of medicines, and we were told how to give the medicines. Along with that, the physiotherapy also has been advised to us what kind of exercises in sleeping condition we have to follow. Plus, we were continuously advised he is having a major critical injury, so he has to lie down, he has to sleep most of the time, he has to take rest and things like that. So with that, all mental stress and the lot of responsibility, how we'll manage at home and this and that, like we took a discharge from hospital, we got him home. So as they suggested, like we started the physiotherapy. Like, see, first of all, for us it was so new, brain injury, spinal cord injury, we never heard of. Basic treatments like heart attack, diabetes, at least we are aware of few things. But this was like completely new thing for us, but still we are trying from our reliable sources, internet, through information, through friends, families, how better ways we can improve, get the improvements in Shreyas. So in that confused state, like, we followed whatever the doctor has said. Again, here, while the discharge, during the first time of discharge from the Mangalore, we got a very supportive attitude from the doctor. From here, from getting discharged, like, whenever we used to insist them, like, regarding the removal of RT and this, that, they always used to tell us, your son has improved so much, so you thank God for that. Such patients remain on the RT feeding. You have to learn yourself for the RT feeding. Urine bag, so it is mandatory for such patients. And we were like, got so negative replies for them. Somewhere we also started thinking, my God, my son is not going to stand and sit up and walk again. So that this completely two contrast experiences from the medical field, like, we got him discharged and we were following the whatever doctor is saying, we were following the same thing in terms of exercises. One belt was given to him, he was not allowed to sit for many hours or together. Few minutes also he used to sit, he used to complain neck is paining, back is paining. Most of the time he used to lie down. Then whatever the medicines they told, we used to give him. Most of the time he used to feel drowsiness, very drowsy, used to feel very lazy, very reluctant to get up. More than 18 hours he used to sleep, and no activity as such, no activeness, very calm and cool. He was like lying down on his bed. Though the physiotherapist used to come on sleeping position only, the exercises used to happen, and that's it. But after continuing this process for a couple of months, like his body was getting more stiffer and stiffer, constipation started. In this condition, so we don't even expect that sensation getting, because below waist he is paralyzed because of the right side brain injury. His entire left side was paralyzed. He's motionless from left side, from top to bottom. Even his left hand was completely paralyzed. After doing these exercises also, after 3 months, like he could not even get up from bed on his own. Parji, slide please, third slide. Like we used to have couple of people from the family to make him sit on bed. He was on sleeping position. Two people used to be there to make him sit. So he was completely 100% dependent on his on others. So we were in continuous inquiries ki how he can be improved further physically, cognitively he was so bad. We do understand the brain injury is there. He could not even remember what he had in the breakfast. If I ask in the lunchtime, what you had in the breakfast, he could not remember. So we were a bit worried about his future, his further improvements, like how we should go about it. So during these 3 months we were not sitting idle as such. Through net, everything, we were going on for inquiring. In one day we could find a stem cell therapy in the net. We were very keen to know about it. On internet we got many information, so we thought might as well to go to the concerned authority doctor who knows, who's expert in that, and take the advice from him. So we have taken a very good stem cell therapist appointment. After a lot of struggle, after 1 month, we got an appointment. And like when we went there, like we could see that he showed us many interviews and everything of his old patient, how the stem cell has improved the patient from dependent patient, how he has gone to dependency, their eyesight improved, physical improvement was there. We got so carried away because we were so keen to have Shreyas, to get into the normal as soon as possible. So we just decided we'll go for this stem cell. Like, though the cost told by a doctor, stem cell is like beyond our capacity, because past 6 months we have spent huge money like anything on Shreya's treatment. But it's okay. Any parent would have thought, forget the money, we'll just get it done to have the Shreyas independent on his feet again. So after quite consideration, we went for the first stem cell therapy on November 2011. We got that painful surgery done on Shreyas. He had suffered a lot, severe headache, backache. He cried a lot after the surgery, after effects of surgery. Then he cooled down after a couple of days, and like again the physiotherapy has started, where we had been advised to use calipers, and the suggested exercise were making him stand with the support on board, with the calipers to be used, and move the legs, everything in sleeping position, like passive movements kind of. Next slide please. So whatever the exercise were told, we were doing. You can see in the slide, we were doing all these exercises where we were doing continuously 2 to 3 hours. The physiotherapist used to come and they used to take these exercises. But still, after doing these exercises for a couple of months, 3 months, like you can see, three people were needed to make the Shreya stand on his knee. He could not do anything on his own. His left hand was like that only, with no sensation at all. His fists were getting tight, leg spasticity was there. So we were worried, like after doing stem cell also, no improvement at all. Forget about the cognitive improvement, no physical improvement at all we could see. So we again reconsulted the same doctor. Again, he told us the same dialogue that we used to hear 6 months back. He has such a traumatic accident and so severe injuries. How you can expect him to become so normal? So much he has done, this, that. But still, our insistence. Then he told us to do n number of test, like SACP test, urodynamic test, and couple of more tests, which was so expensive and time consuming, to show us the result, how internally he is getting developed. So he showed us the report and told if he has started improving, but his injury is major, so like you have to go for the another stem cell. one more time to get the better result. We were like shocked and shattered at that time. Again, such a huge expense, like how to go about it. But after given a second thought, like we thought so much we had done it, so why to lose this last hope also? You never know if he is recovered and he can stand on his feet again. So again, we have gone for one more loan, and we have done the second stem cell therapy also on Shreyas. That we have done in after 6 months of first therapy. Again, the series of physiotherapy, putting calipers, this, that, everything happened. Like 3 months have passed, 4 months have passed. We were in June 2012. Like nothing, no improvement was there. His leg spasticity was as is. Urine infection was continuously going on. He was continuously on antibiotics every day. Every month I have to give the urine for testing. Then this infection is detected. Then again the antibiotics to change. That vicious circle was going on. His hand getting tighter and tighter, body getting stiff. He is getting overweight. He was getting obese. So we were not knowing now what to do. You know, whenever you used to go to ask doctor, they used to say that he has improved so much. No, you thank God for that. So, you know, suddenly because of this continuous replies from doctors so negative, you know, somewhere we started feeling it might be like, you know, the injury was so severe, so might be stress might not improve. That's it, what he could, he has to live with it. Unless and until we got to, in this confusion only, we one day we find one article in Marathi newspaper saying that Midas touch, Parisparsha. Like I've gone to the article, and it is for the brain stroke patients and the patients who are having such kind of problems, or brain injury or spinal cord damage and things like that. Again, I thought we were so fed up. Of 1 year we have done trial and error on Shreyas, all experiments under the name of treatment and rehabilitation with no use at all. He was as is bedridden. So after reading the article also, we give a thought and again one more treatment. But when I read the article very in detail, like two catchy points I found the most. That is, it is free of cost, and first of all, no medicines, no treatment, no therapy or as such operation is involved in that. So that could not sit me quiet, you know, what is in such a thing. I have done so much of advanced technology, we have gone through so much medicines he has taken, so much physio he has done, not a single person improvement in him we got it. So how come whatever this therapist Vasa concept is there, how can it be without any medicines a person can improve? So with that keen curiosity, like we decided to go for to meet doctor once. So after completing the procedure told by the concerned person, we finally got the appointment of Dr. Vasa. And one day we got an appointment, and when we went there to the workshop of Vasa, we were amazed. You know, we were amazed. The family members, the parents themselves were doing the exercises on parents. Like we were wondering, because we were having that fix in mind that the physiotherapist has to come and do the exercises so that no internal damage happens to child or whosoever patient. But there we saw all the family members and involved. And very nice thing was that we were allowed to talk to the parents also. So we went there, we talked to them, and from each and every one we got such a positive reply. So enthusiastically they were telling about the improvements in their child. So we decided, no ways, we'll go for it. It is a last try, but we'll go for it. And let me tell you, it is what we have taken a decision proved to be the blessing for Shreyas. The moment we started the Vasa concept, within a week's time, you know, we could find the improvements in Shreyas. As I told you, like he used to be always drowsy, sleepy, continuous running nose, fever, weakness he used to have. After joining Vasa concept, we got one task after task, exercises. After that, when we started doing the exercise, everything, we could find the difference in Shreyas. You know, in terms, not only in terms physical, the facial expression, the physique, the entire physical condition of Shreyas. You know, he used to look very fresh, like he used to be there like before accident. Like then within 4 months after starting Vasa concept, within the 4 months, Shreyas could sit on his own and sit on bed on his own without any support. That is also. So we were very keen. So one after the another improvement, used to happen. We just followed whatever the Dr. Vasa ma'am used to tell. We used to follow those exercises, those tasks. We used to do that for number of hours as prescribed. And like we used to see the result automatically coming in. Like we do not have to go and ask, we are doing for so many days, so many months, there no improvement. No ways. Like we started within the week's time, we started getting the improvements in Shreyas. He not only improved physically, but we could see the development in cognition also. Like his memory started improving. He started remembering better than earlier. Like past 1 year, his condition was there. Plus his left hand, which was completely paralyzed, within 1 year's time, his shoulder movements, voluntary movements started till elbow. Like we were amazed with Vasa concept. We just do have to go to the to Vasa workshop. We have to take the prescribed task or the exercises given by her and follow that unconventionally, very honestly. The result used to come. There were so many improvements. It's like because of lack of time, I cannot list all because it's a journey of past 9 years. But I would like to say major improvements within a 1.5 years time. Shreyas could sense for the urine. Within 1 year's time, his urine infection stopped completely. It started getting reducing within few months, and within a year's time, no urine infection at all. We never done any test, no antibiotics, nothing. When we started joining Vasa concept, like we had been told to stop all the medicine, stop using calimus. Yes, we got shocked, like how can we stop the medicine at this stage? But okay, we had developed the trust. Within a week's time, we just thought to listen whatever has been prescribed to us. We stopped the medicine, and from the moment we stopped the medicine, we could see the improvement getting faster and faster. Within a 1 year's time, like his left hand started moving, his tight closed fist was started opening up. Within the next year's time, like he could even have the urine sensation. Not only that, even he could able to sense the whenever he used to pass the motion, which was not there at all past 2 years. Moreover, during this exercise, at one side we were very happy to see improvements after improvements in stress in lot many terms. Once fine day, like we started feeling his right knee very warm. Like it was very getting hot after exercises and all. So like we were concerned and told Dr. Vasa about that. So she just told to calm down, to wait for some time. And one fine day he had got a abscess there. Like the area which was getting warmer, it got burst open. Like how we got a boil and get burst open, the bigger version of that. It's called abscess. That's what doctor told. We were panicked, like now what is this injury and how we have to do it that. But to be very surprised, Dr. Vasa told it is a time to party. Like I was like thinking, how can it's such a big injury? Party slide, please. It is such a big injury. Like how can one think of how it can be a sign of improvement? But soon we realized that yes, was a sign of improvement, because it was the body cleansing process. The body was getting cleansing all the unwanted, because of this unnecessary medicines and treatments. Whatever was getting accumulated in the body was gets thrown off. Like so, like how to do with it, how, because how to heal that and when it will get healed that. But Dr. Vasa has the entire plan of action ready with her. She just told ki wait and watch. She told us how to do the neat clean dressing and everything at home. No need to go to doctor. I have done it for 9 months. It took 9 to 11 months for the first abscess to heal. But with her guidance, we did the dressing and got it healed without any surgery for that. That is something very specifically I would like to say. Such a big abscess, and this is not for the one time. Shreyas had this abscess for 3 times. 2 times after that also he had. But most important is first abscess, it took 11 months to recover. But the recurring abscesses got recovered very faster, because Shreyas in her body was ready for that, to get it recovered. At the time of this abscess also, Vasa concept didn't stop. She had the another plan of action, another set of exercises, concentrating more on his left hand, his wrist extension, his finger movements, his his shoulder was drooping down from left side, his posture was tilted. So more concentration was given there till this 11 months. So at the one time, first time the one thing is getting injured, so other parts of the body is taken care of in terms of improvement. After that, in this abscess condition only, whatever the exercises and tasks were given, the proper plan was given to us, we followed that strictly. And by now, like Shreyas, which was not even able to sit on his bed without any support, can stand alone without any splint. Of course, little bit support is needed because after 9 months he's touching his feet on grounds, but I'm very happy to say that with Vasa concept this was possible. Even he has developed a trunk control so well, he can move his body, upper body parts above waist very nicely, very controlled manner. Parji, next videos please. Where you can see, he is moving his body on his own above waist. Previously, as I told you, because of his spinal cord injury, D7 vertebrae compressed, like his below waist, he was completely paralyzed, senseless. Even he had first abscess, I was doing dressing. My hand used to shiver to do this such kind of dressing, but he used to not feel anything. He was talking, wiggling. But at the third time when abscess happened, he used to, take out his leg, he was having some sensation developing there. And yes, within like past 1 year, he could move his right leg fingers voluntarily. He can move his right leg voluntarily, which was absolutely below waist, absolutely still. He was not having any sensation, movements, to forget it. So like all these developments we could see, in during our 8 hours of journey after Vasa, with Vasa concept. I would like to say my experience when I've seen in workshop, like she is personally involved in every patient, and like she has the plan of action, the every like very systematically Vasa concept is arranged. First of all, we get appointment also after giving the protocol. We have to give the everything, all reports to her, whatever treatments we have done, whatever we are doing now, how the daily routine of the patient is going on, that with the CDs, with the reports. Then we get, after getting a protocol detail, whatever she is required, then only first appointment we get. After that also, if you are joined, whatever the prescribed plan of action is given to you, if you are following that weekly, you have to report her through a mail, through videos, telling her that okay, we have done this, we found this improvement, our observations we have to see, we have to mail her, or we have to convey to her. According to that, the further appointments are given. So everything worked in so prescribed manner, which I have never seen during the first year of injury after accident. We were just dictated the number of exercises. You go and do this for this minute, this for this minute, that's it. Then whether the improvement happened, any problem is you are facing, nobody is bothered to ask. But unlike these conventional methods, we found it very supportive atmosphere in the Vasa concept. In fact, you can say Vasa concept follows all the patients. We all patients work together in workshop, asking each other's experiences, share each other's experiences. So it has become a huge Vasa family as such, where we are free to talk to parents. With the parents are free to talk to me, take whatever the problem I am facing, might be the same problem some child must be facing. We can internally react, okay, I have done like this, so you can take that experience. So the concept is endless. How much you can grasp and how much you can improve, get improvement in your patient is up to you. This freehand working, is found only in Vasa concept, which I have found past 8 years. And to be very honest, like it's not only that, like we have to see meet the patients over here and things like that. We have in the workshop, I have seen many foreigners coming here, staying here in India for months together to take her to follow the Vasa concept, take her valuable guidance. And we are free to even talk to them. Parji, next 2 slides please. Like during the workshop, they were free to ask us our experiences. We used to work together with foreigners. Like I feel so proud to tell, Vasa concept is a global concept. Usually Indians run, whatever the problem is happen, like Indians run, will go to USA or will go to the here and there for the better treatment, advanced treatment. But I'm proud to say that Vasa concept is such a concept that foreigners come to India to take her treatment, stay back here. It is something really, really feel proud to be, because I'm part of it. I feel so proud about it. Even I have seen the development in Shreyas is overall development. Like, generally I've read in internet, like whenever the person is having brain plus spinal cord injury, like the part was getting affected, it remains the as is the smaller than the as compared to other body parts. But if you can see, Shreyas is sitting besides me, nobody can even judge that looking at his physique that he had come from such a severe injury, critical injuries. Thanks to Dr. Vasa and her fabulous concept, miraculous concept. One more thing at the end, I would like to tell about Vasa concept and Dr. Rajul Vasa, that whenever we used to discuss, she always used to tell that the mother is the best doctor for a child. I am here only to guide you all to a correct path, so that you not go to a wrong path and have the child affect badly. So this is the concept, this is the selflessness of ma'am is shown. You can see now also, like such a big scientist having such in-depth knowledge, she should have conducted this webinar on her own, showing the slides of our children, telling that this is my concept, and generally all doctors do. But she has given us local people, ordinary people, to share our experience. It's her greatness is seen in that only. Not only Vasa concept is there, she is having the selfless work 24/7, which is very influencing all of us, giving us energy to work on our child more and more. Because the more we work, we get the positiveness in our child that gives us an energy to work more. So that is the crux of Vasa concept. We are on this enlightened, empowered path given by her till now. We will continue our journey, and I know our destination will not be so far. We'll reach the destination soon. At the end, like Shreyas, about whom I'm talking so much, he would like to say something at the end, and we'll just finish it off. Yes, Shreyas.
Good evening on Shreyas here. So far my mother have told you all about Vasa concept and a journey past 9 years. And there is a founder of the Vasa concept, the great scientist and highly respected and dearest Dr. Rajul Vasa ma'am. During each workshop I have seen her concern, love and care for each child. She is ready with a plan of action for every one of us depending upon her progress report. Ignorance or error, though very small, by a parent's side is noticed and highlighted by ma'am. Since childhood I have been reading storybooks that God cannot reach everywhere, so he sends his angels for help. Dr. Ma'am is one of such angels. Her kind and selfless nature, in-depth knowledge and hard work makes her a gem of person. Today I am here in front of you all speaking it just because of her. Thank you so much, ma'am. We all love you.
Yes, I would like to thank you for the Vasa concept and Dr. Vasa for his tremendous knowledge and like work on our children, like to make us so much independent, to bring him towards the from the dependency to independency. I'm really thankful for being a part of Vasa concept. Thank you all. Thank you.
Yeah, thank you very much, Shreyas and Padmashri.
Thank
It
you.
was very inspiring for all of us. Thank you so much, and wish you all the best, Shreyas, for your
Thank
future.
you.
Yeah, thank you
Thank
so
Thank
much.
you, sir.
Viewers, I can read certain comments about the certification and the link. I have shared the link in the chat as well as in the description also. So you can take the link from the description for the forms. Don't try to fill the form right now. After finishing the program, you need to post 3 screenshots of your presence in that form. As far as screenshots are concerned, it should be in JPEG format. Then and then you will be able to upload it. If it is in any other format, it's not possible. So if you are not saving in JPEG, then either you convert it into JPEG or directly save it into JPEG format and then save it. So these are the things are necessary for the certification and form filling. Thank you so much, everyone. Milind bhai, can you let me know who is the next? I think Suresh bhai. You are on mute, sir.
No. Okay. Can you hear me now?
Yes, yes.
Okay. So now I will go next myself, and then after that it will be Suresh bhai.
Yeah, please, sir.
Okay. So hi all. My name is Milind Tadegaonkar, and I'll be sharing experience of my wife Seema, who was a hypoxic stroke patient for since 14 years. And out of these 14 years, the first 13 years were with the traditional physiotherapy and neurology and so on. And but the last 1.5 year, I've been associated with Vasa concept and taking the treatment of Vasa concept. So first, I will share my experience with the first 13 years. What have I learned, and uh, you know, and what therapies had what kind of impact. And so first, advice by a neurologist to us was that there is no medicine for this. And let me just first share with you what happened really, what how she got into a hypoxic stroke. So Seema was admitted to a hospital for a normal cox infection around the lungs, and while the chest physician was inserting a ICD, she went into a cardiorespiratory arrest. And we don't know what transpired in the operation theater, but there must have been a gap between the time she had arrest versus resuscitated, and there's a big damage to her brain, internal hypoxic brain damage. And after that, she had to be kept in the ICU for 3 weeks, almost in a comatose state, and no responses in that state. Uh, then, after some other complications, she was there overall 2 months. And then, as we were getting discharged from the hospital, there was one very notable observation by a doctor. They said this kind of damage is something that we don't know how long it'll take. It can take 15 years. So basically, there was no hope, not much hope from the doctors. So ironically, Seema had walked in herself to the hospital for just an infection around the lungs, but she came back on a stretcher with significant damage to the brain. Now, after she came back home, there were good improvements for the first 6 months, and so she could, get up from the bed, stand up, and so on. But after 6 months, her recovery just got stagnated, and that is where we ran into many problems. And so let me just describe to you her state. And Seema is a representative stroke patient, so this will be applicable for many such patients. So she didn't have much motor control abilities, not able to balance, no fine coordination. So she could not uh, stand up or walk on her own. uh, she could not wear her own clothes, could not take food. And so we were in a situation where we had two daughters, young daughters, but she could not cook anything for them, and that was quite frustrating for her. And you know that state went on. Then we went to a neurologist. They said the only hope is physiotherapy. So we went to the most advanced neuro rehabilitation center in Pune, and we took her there for 3 years. They had 2-hour regimen for every day. So they would go through manual physiotherapy, then treadmill, then electric stimulation or current to the right ankle. And that I wanted to mention that one of the problem at that state of Seema was that her right ankle was frozen, and she could not voluntarily move it. Therefore, she could not bear any weight on it. So they would give electric stimulation to that. And they had also a couple of large machines, which are like kind of cycling machines for the patients, and they had high-tech computers attached to them. So I knew that this is going to take time, so I was not asking them every week or something. But after every few months, I would ask them, what is the progress? And I was hoping that being an engineer myself, I was hoping that the machine will give some data or some indication of what is happening. But absolutely no inputs from those machines as to whether there is any improvement at all in SEMA or not. And then there was a final trigger when we decided to stop going to that advanced neuro rehabilitation center. And that was they were forcing her to walk on a treadmill with ropes attached from the ceiling, and that was quite terrifying. And I could see that she was freezing because of that, and I could not have any dialogue, meaningful dialogue with the physiotherapist as to what is the purpose, what she's going to get benefit. So we just stopped that. Now after that, we were really clueless what to do, and then there was some frustration building up. So our family members started suggesting that why not go to this doctor, that doctor, based on more of popularity than any specialization consideration. So we tried doctors in Ayurveda, homeopathy. Even there's an ancient therapy called Marma therapy, which is supposed to stimulate the nerves, and acupressure and whatnot. Of course, none of that worked. I was not worried so much about the time loss or money loss. The biggest impact, as I saw it later, was that it was on the SEMA psychology. Because for a patient, with every new doctor and every failed treatment, it is a shock for them, and every new disappointment adds to the anxiety or this thing psychologically. So at that point, she started getting migraine attacks, and so she would get around about one or two attacks every week, and every time she gets attacked, it was extreme headache, and we would lose at least a day of any possible therapy. So moving on, we learned our lesson that doctor shopping is a bad thing to do. So that is one learning we learned. So we said, okay, let's give a serious shot to physiotherapy again. So then we found one physiotherapy center, which was again neuro specialized, but they didn't have any advanced machines. They did give personal attention initially. So I could see what exactly they're doing at a high level, and then I could talk to them and understand what is the line of treatment. So what I observed was the physiotherapy was more passive and, of course, more on the weaker side. And there was not much improvement visible. So in the assessment time, I would watch what they were doing. So what they would do is they would rate the strength of the muscles on a 1 to 5 scale. So something like -1 to 5 plus, something like that. I used to wonder, the problem is motor control and balancing, and how is rating strength of a muscle going to help SEMA? Anyway, so I sort of said, let's. They are the experts, so maybe they know something. So we carried on. What happened then was the physiotherapist kept changing after a year. I think they must have got tired. They didn't know where it is going. So new physiotherapists kept coming. Then they started forcing her to walk, and we felt that okay, maybe we should also make her walk. So we were also making her walk at home, and then SEMA started falling. Okay, and it was more dangerous because this time she would fall forwards, and most of you know that brain patient doesn't have the reflex action needed to protect themselves. So she could not use her hands to protect her, and most of the time she landed on face. So I remember one incident where I was sitting, and then she was in the kitchen trying to move on her own, and she fell directly on the kitchen platform's edge, the edge hitting the nose. So a lot of bleeding and fracture and pathetic sight. So I was like, what is happening? So then I tried to analyze, and then I'll just share with you what I could see. I'm not a medical professional, but I'm a science student. So I try to understand what's going on. So what used to happen is whenever we or any therapist used to hold SEMA's finger, even one finger like this, she could walk with fair amount of confidence and balance and whatnot. The moment you leave that and she is completely independent, then what will happen is her right hand would go near the body, stiff. Her right leg will also go near the body, and the foot will curl inside. So I could see there's a reaction. If you leave her independent, there's a problem. And but then the physiotherapist kept doing it, and this, of course, I must mention. I wouldn't have figured this out myself. I was at that time I was watching also. Saw an interview by Dr. Vasa madam, and I saw that uh, walking can be a problem, and there is a major mindset issue here. So this is something which I have understood. Thanks to Dr. Vasa madam, who has been guiding me over the last 1.5 years. I've been guiding new patients and so on. So what I've understood the mindset is, people normally think that they equate recovery equal to walking. Now that may be true for other patients, but for a brain patient, many times the brain patients are not ready to even stand or maintain balance. They are not able to, like Seema was not able to get up from the ground if she fell. There were times when she fell and she was alone, and my daughter was stuck outside because she didn't know how to get up. So a patient who is not able to get up or stand on her own, you force her to walk or climb staircase. I later realized that it's a major issue. Anyway, as luck would have it, she fell again right in the physiotherapy center itself, and she fell on her face, and that was like the time we had to stop everything. Parth, can you please bring up a few slides? The first slide. So here we were all a happy family before the hypoxic brain injury, and let's move on. Okay, just stay on this slide. So this is just representative that with every new therapy, it later on I realized, and I look back, and I look at the videos. I have videos of walking videos, other videos from 2009, 10, 14, 19, and so on. And I can see that her walk actually became worse and worse. Her right hand started coming closer. Both hands started coming closer to the body. Her right legs started curling. Foot started curling, and she would land on the outer edge of the right foot. So that started happening as they started forcing her to walk. Okay, so much so about that. We stopped that physiotherapy. Then I will share with you the last learnings from the neurology department. So a couple of common points came out from neurologists. One is that there is no medicine for this condition, hypoxic brain damage. There is no surgery, but there is also a pessimistic outlook. So indicating that neuroscience doesn't know if there is any solution to this. But there's another common statement I'm hearing I heard from these 4 neurologists. They said that if at all anybody has any hope to treat or get rehabilitate a neuro patient, it is the physiotherapist. So that is a positive note. And I just forgot one quick thing I mentioned. One of the neurologists gave a strong list of medicines, and my wife had a hope that out of this long list, maybe there will be one magic pill which will solve this problem. So she religiously took those strong medicines for 3 years, and we later on found out that they were all sort of palliative. They were making her sleep more. They were chemically reducing her anxiety and depression. So through all this falling and all that which I mentioned, by that time she had gone in depression, and this neurologist made her sleep more. So the combination of falls due to force for walking and a sluggish brain due to heavy medicines had a pretty bad impact, because she would sleep most of the time, not able to learn anything. Brain was in that kind of state. So that takes me to my next topic as to after Vasa concept or during Vasa concept. So fortunately, I saw a video, and then I took an appointment after completing all the paperwork, and we got an appointment of January 2019. And that's when we started Vasa concept. Now, the way I would like to share, Parth, can you just give one more slide, please? So before we go to Vasa concept, this is the state Seema was after traditional therapy. If you notice, her feet are pretty deformed, and they were not so in 2009 and so on. But because of all this, they walking and all that, they got deformed. And the fall was so bad that the neurologist asked us to do MRI. And fortunately, there was no internal injury. So fortunately, again, I found Dr. Vasa, Vasa concept as a solution, and took an appointment with Dr. Raju Vasa madam. And in January 2019, we started this. Parth, can you stop the slide now? That slide is depressing, so I didn't want to see it for too long. So let's see what happened in Vasa concept. I would like to share this after Vasa concept experience in a few parts. Basically, one is the transition part. What did we learn as we were still new? There are some misconceptions that people have, and there are some do's and don'ts that Vasa concept tells us to follow. And then in between, as a part of that, I'll also share what are the results we started getting as part of Vasa concept, doing all those activities. And then after that, I will also, I would say, introduce to you, because so far we have not talked about it, introduce to a fantastic, I would say, feature of Vasa concept, and we can call it Vasa concept empowerment. So we'll see what that empowerment means. Okay, so let's start with the initial stages transition as we started learning Vasa concept. So first thing we did was, as per advice from Dr. Vasa madam, we started all the neuro drugs, and we did it in a pretty tapered manner. Try to look on the net, and even I visited one neurologist, make sure I'm not doing any mistake. And there's one pill which took us 3 months, but all other pills we stopped within a matter of few weeks. Now, immediately, situation changed, because instead of sleeping for 14 hours, she was now awake for entire day like a normal person. She was alert. Her brain was ready to learn. First good thing in just a few weeks. Second thing, as a don't, that Dr. Vasa madam had asked us, that don't force her to walk. Even if we are going out, put her on a wheelchair, but no walking. So no walking means there was no need for splint or special shoes, etc. And so after that, as that happened, and as we started Vasa concept activities, feet situation started improving. Okay, so that was a good. Her skin started glowing, so that was a good thing. Her depression started coming because she was getting some hope. Okay, now I'll come to one misconception. So one misconception that people have, some of them even after joining Vasa concept, is they think that it is a set of exercises. Now, Vasa concept is nothing close to exercises. It is a far higher, broader and deeper concept. And the one difference, I'm not getting into details of this, but I'll just, something that normal science person might be able to, at least try to understand. So what I try to understand is basically prevalent physiotherapies, are concerned about gravity, and then they give props like walker and stake and so on. Whereas Vasa concept tries to exploit gravity. So it tries to, through its activities, it tries to establish the positive connection between patient's brain, body, and gravity. So Vasa concept has a very deep, very solid scientific basis. So it is not an exercise. But anyway, some people think that it is exercise, and they either don't realize the importance of it, so they make their own changes to it. They don't follow some of the specifications, and therefore they don't get the desired results. So having gone past that misconception, let us see another important principle or a facet of Vasa concept. In Vasa concept, again, compared to general, outside what happens or any other diseases, typically when patients are sick, they think they have to rest to recover, and family also think they have to rest. But Vasa concept does not look at brain damage as a disease. It looks at brain damage as a condition. And like I told you, it exploits gravity. Therefore, it prescribes that the patients do hard work Vasa concept activities for 6 to 8 hours per day. So, in other words, it's a contrast change. Unlike rest to recover, here it is aram haram hai. So, meaning work is worship. Everybody has to work. I mean, the patient has to work for 6 to 8 hours, and the family has to enable the patient to work for 6 to 8 hours. So that is another basic principle of aram haram hai, which sometimes people don't like that. People are used to shortcuts or somebody else doing, physiotherapist doing everything, and they will just give their arms and legs to the physiotherapist. Vasa concept is nothing like that. Now, as SEMA did all this work, what result we got? Okay, so one thing I had not mentioned is because of all these drugs which made her sleep, she had put on 10 kilos. And after few months of Vasa concept hard work, she lost all those kilos. Her fingers started straightening. As I said, her feet also were relaxed, and the right foot was improving. The curling started reducing, her knee recovery attempt started reducing. Okay, there's one last physical result I will mention. Parth, can we show a slide, please? Next slide. Okay. So as you can see here, her feet after or during Vasa concept are substantially better now. Her skin was better. Can we move on? Next slide, please. Okay. So now what is U-turn? So there are a couple of topics, couple of factors for the U-turn. One result, or we saw, I told you in before Vasa concept situation, there was a time when she had fallen and she didn't know how to get up. However, with Vasa concept, there are activities which have helped her to go in mobility from sofa sitting to ground to sitting, and sitting to stand. Of course, she was doing, but even stand to ground, she could do that. So that is giving her and us, all of us, a confidence that before we attempt the final frontier of walking, we are taking the necessary baby steps. And thanks to Dr. Vasa madam's guidance and her, the fact that she has allowed me to work with some patients, I've seen many patients that they have done this U-turn and they have come out. And we saw one example, brilliant example of Shreyas, who is appearing 10th standard now. So I know that we have taken a U-turn, and then we are finally moving in the direction of true recovery. So I don't want to get into compensation and compromise. Those are physiotherapist technical terms, but I can see that Seema is on the path where she is improving not just her physical movements, but emotionally also. So how is it? How is it depression coming? How is that her depression has gone? Now that takes me to the most significant aspect that I've been involved with, and we'll call it Vasa concept empowerment. Okay, so Vasa concept empowerment has three aspects. One is it empowers the families first. So families are told, educated by Dr. Vasa Madam as to what is important, what is not important, and what to do, what not to do. And in that, we are told that, I mean, we are trained, families are trained by Dr. Vasa Madam and her team how to do these VC activities, Vasa concept activities ourselves at home, at the comfort of our home or garden. There is no need to, go to any center, pay money to anybody. This is all free. So the way this model works is families help the patients do the exercise initially when the patient is new to Vasa concept, and patient does it at home. After every few months, families send the videos of current status to madam. Madam sees the videos. If the improvements are as per expectations, she may give the new set of exercise. But many times there may be some errors in what families are doing, and she will guide as to what needs to be done. So this empowers the family that we don't have to run every week somewhere or every month somewhere. We just focus on the patient and help him or her do the Vasa concept activities. Second, empowerment. Okay, this is also very fantastic. One is the Vasa concept activities, though they are based on highly complex scientific principles, very deep. She has done a lot of deep research over many years, spending midnight oil. But what she has come up with finally are simple activities, which variety of brain patients, whether it's TBI, stroke, cerebral palsy, spinal injury, whatever age, little kid, middle kid, old person, all of them can eventually learn. Initially, they'll need some holding, guiding. But the beauty of Vasa concept, the biggest beauty as I felt and seen in Seema, is that I was just amazed that she was able to do certain exercises herself over a period of time. So that is what creates that confidence in the patient that she is not dependent on anybody for the core activity or recovery mechanism. She can do, there are at least 4 or 5 she can do alone. There are others where we help her, but she can do those activities herself. So that is the first step towards independence, is at least you can do the activities which some call exercises, which I call activities. She can do it herself. So family empowerment, patient empowerment. Now the third very interesting empowerment, I would call it economic and social empowerment. So economic meaning, many years back she decided she's not going to take any money. So that means patients or families from variety of socio-economic layers can approach Vasa concept, can get the benefit from it. So there is no agent or any, there's no money level issues involved. Second thing is, so this is a direct cost saving. Now there's another indirect cost saving which I realized, or which I sort of realized only now, financially realized. I mean, is that we had to go to for 2 hours to physiotherapy. So that was like 600, 800, whatever. And then we had a full day maid servant. Now Seema has reached such a level that we don't even need the maid servant. So every day we are saving more than $1,000. And I have retired for Seema, so I'm thrilled that I don't have to dig out all my savings. And it's not just about me. It is to just think about it. Think about what this model can do to India or the world or Finland. I mean, this is something that can change the life of brain patients. You look at the contrast, what was happening to Seema or This fellow, our friend in 10th, Shreyas, before Vasa comes in, what happened to them after Vasa comes in? And this is, we need to take a pause and think what this can do to brain patients of India and the world, because totally different mindset, totally different radical pioneering, revolutionary, whatever you can call it. It's not based on money, it is based on empowerment of the family and patient. uh, so it is basically knowledge, and so I used to wonder, how Dr. Vasa madam got this. So in one of the interviews she said that she was so much. I mean, one thing I would like to mention about her is, uh, I've talked about my wife to many different people, doctors and friends, because I used to get frustrated and I wanted to always share my pain with somebody, but not many people understood what is brain injury, and then what to do with such patient. So people said, "Oh, she can move around somehow with walker. Oh, she's not bedridden. Okay, great." But as I explained to you, I mean, our situation is absolutely pathetic. It was going down, where she had gone into depression, and the whole family was in panic or depression. And so I think this brain patients become prisoners of their own bodies, and this is not understood by. And I don't blame them, because they may not have seen such patients closely. So, so the quality of Dr. Vasa madam that I wanted to share with you is, she's one of those few people who is not only empathizes and understands whenever she looks at any brain patient, what that brain patient has been going through, why his limbs are in whatever state they are, what that patient must be going emotionally, psychologically. Simple thing that we need reflexes to kill a mosquito. These patients cannot do that simple thing, or some of them cannot go to bathroom on their own. So many of those grown-up kids. So anyway, we will take those cases later. So coming to Dr. Vasa madam, I feel that she has the ability to empathize, understand, and then that is the reason she's thought deeply about this empowerment and come up with this model. Not only the scientific part, because I don't understand, we're not that covering that in first 2 days like Dr. Neeraj said, but there is a deep scientific uh, revolutionary invention, which we can call invention of the century, because if you look at 100 years back, even U.S. Politician Woodrow Wilson had this thing, paralysis. He had problem. Even a few years back, Mark Kirk had paralysis. Even he had. He was not able to get up. You look at YouTube. You look at internet. You will see Mark Kirk. They spent $30 million on trying to get him to walk the Capitol Hill. They could make him walk, but with somebody's help on left shoulder and right shoulder stick and all that. And few years after that, he is wheelchair bound. Or you look at Satya Nadella's son, Microsoft CEO. Just look at in the US, most advanced country. He's a cerebral palsy but wheelchair bound. So the uh, point I was trying to drive at is, the life of brain patient is extremely painful across the world, whether it is most advanced country of US, and we will see what's happening in Finland, or India, or anywhere corner of the world. And here is a solution, which is invention, which has been developed within our own country. And we have realized our own potential last few years. And here is another invention with great potential. And if we, our own Indians ourselves, do not look at this invention and then look outside, I don't know. I don't know what is the solution. So anyway, with that, I'm going to stop. Okay, Dr. Neeraj, we can go to the next. You are mute, sir.
Sir, mute sir, sir.
Yeah, I wish that this amazing concept will be spreaded very soon in the society, and people will be benefited out of it very quickly with this concept. Thank you so much. Friends, if you can't see the link in the description, kindly refresh your YouTube video once again. You will be definitely able to see the link in the description. And I just let you know that you upload all 3 screenshots at a time. Don't if you will try again and again, then you will not be able to open the link next time. So that is the limitation we have put. So you can open the link only once, and you can do only one entry. Okay, so this is the thing. So Suresh bhai, please come.
Okay, sir. Thank you very much. Good evening to everybody. This is Suresh Bhai Patel, Surat, Gujarat, India. Telling the story of Jenty Bhai, who is my younger brother, and I'm sharing the slide. Telling the story of Jenty Bhai, my younger brother. He is 41 years old. Presently, he is in coma and unconscious. He is in vegetative state. Here, I am going to narrate the recovery of life journey of Jenty Bhai. Jenty Bhai is 41 years old. He is very active and funny. जयंती भाई सामने वाले की आवाज की नकल और एक्टिंग दोनों कर लेते थे. He used to go to gym every day. He was fond of trekking out to the jungle and mountains once in the year. Jenty Bhai had last visited Kasol, which is in Himachal Pradesh in India. On 12th October 2019, suddenly, Jenty Bhai had a terrible and fatal heart attack at 2 hours 15 minutes early in the morning. His heart stopped working at home. Within the 15 minutes, we took him to the nearest hospital while pumping to his chest. At the hospital, Jenty Bhai was given CPCR and 3 DC electric shock by the doctors. After about 40 minutes, Jenty Bhai's heart was started. At that time, his heart pumping was only 10%. Later on, angioplasty was performed to Jenty Bhai's heart. During all the events, Jenty Bhai's brain was suffered a great loss, which is called brain hypoxia in the medical term. From the same day, my brother Jenty Bhai went in coma. He became unconscious and he was in vegetative state. A tracheostomy tube was inserted in Jenty Bhai's throat in the hospital. After 24 days, although he was in coma, we brought him to our house. The neurophysician doctor told us that the chance of recovery of brain damage patient are very rare, and now you have to rely on God. And you have to look for the miracle from the God. We were suggested to continue to give medicine and physiotherapy regularly. At that time, Jenty Bhai was given 15 different types of medical every day, including the medicine of infection, medicine of fever, medicine of brain, medicine of heart, and so on. At that time, Jenty Bhai's blood pressure, heart rate, respiratory rate, SpO2 means blood level in oxygen, blood level into the oxygen level into the blood. All these were abnormal, for which medicine is going on. At that time, Jenty's blood testing and urine testing were done 3 times for a month. And we were calling physiotherapists at home to get done exercise to him. Physiotherapist used to come our house and he used to give physiotherapy like shaking the hands, shaking the legs, shaking the fingers of legs and arm, stretching the arms and leg, and also twisting the arms and leg. During all the physiotherapy, Jenty was asleep. And physiotherapists used to have all the physiotherapy used to have all the passive movements on him. At that time, due to the tracheostomy tube in Jenty's throat, he used to have a frequent throat infection and had a pneumonia. He used to get urine infection and fever also kept on coming. Because of all this, Jenty was given 15 different type of medicine every day. In the month of January 2020, it may be wrong physiotherapy technique and overstretching and over twisting to both legs caused Jenty to have a calcification on the hip of both legs. Because of that, right leg gate mobility from the hip joint got stopped. At the same time, Jenty got a DVT, means deep vein thrombosis on right leg. The physical condition of Jenty started deteriorating. Our family was worried about his well-being. We were doing all the possible treatments to bring Jenty back to our world. But due to the wrong technique of exercise, Jenty had a calcification on his leg. I personally felt that physiotherapy was appointed to do good to Jenty. Then why did calcification happen to him? I think it may be some loopholes in physiotherapy education system for brain-related coma patients like Jenty. That's why physiotherapists didn't know what is the right direction of correcting Jenty. Due to the calcification to Jenty, our family becomes sad and more worried about Jenty. मैं दिल से ऐसा मानता हूं कि वास्तव में वो फिजियोथेरेपिस्ट तो जयंती को अच्छा करने की भावना से ही काम कर रहे थे, फिर भी उनके पैरों के हिप में कैल्सिफिकेशन हुआ। तो मैं मानता हूं कि ये भूल फिजियोथेरेपिस्ट की नहीं है, बल्कि ये भूल कन्वेंशनल फिजियोथेरेपी सिस्टम की है, जो ब्रेन रिलेटेड डिसीज पर कारगर नहीं है। On behalf of our family, I want to tell all of you that if a patient in a comatose condition like Jenty, or if such a patient in your relation, then the patient and his family will have to suffer in the end and will have to lose in the end. In such a situation, we passed almost 5 months. We were not knowing what to do next. Which path was right for us? We were not able to comprehend anything. Then we came to know the scientist Dr. Vasa madam and her science for brain recovery. Then we realized that there is no way other than Vasa concept to cure Jenty. As per Vasa concept protocol, our family prepared and sent all the files of Jenty to the Mumbai office. By the grace of the God, we got an immediate appointment of Dr. Vasa Madam on 8th March 2020 at Worli, Mumbai. After that, our family got some ray of hope, and we found someone who will take our family from the darkness to the light. On the day of 8th March 2020, Dr. Vasa Madam gave a full training to our family about Vasa concept activities. For the Jenty, I remember on the same day, Vasa Madam told our family in a very clear and strict words that if we don't work hard for 6 to 7 hours every day behind Jenty, then we have to give up the hope of Jenty's recovery. Dr. Vasa Madam selflessly helps to all, and she don't charge a single penny from her patient, and she provides social service at such a big level. Our family started performing all the Vasa concept activities on that day onwards. We get by all the Vasa concept activities every day for 6 to 7 hours. Due to Vasa concept activities, we started seeing the benefits in the body of Jenty very soon. The first benefit is you're looking on the screen. The tracheostomy tube was removed in just 40 days, and he started breathing from his nose by himself. From this very first success, the throat infection of Jenty was reduced drastically, and the problems like cough and fever were stopped by their own. And heart pumping has been increased from 10% to 22%. The second benefit is, you look at the chart. That we used to give 15 different type of medicine to Jenty, but now we are giving only 3 medicines along with Vasa concept activities. What a big difference! What a big difference it is. 15 medicines were given earlier, and now only 3 medicines are used. Third benefit is that there was a massive decrease in the calcification in the both hip of Jenty due to 6 to 7 hours of exercises. The fourth benefit is TVT, means deep vein thrombosis, was almost cured from the Jenty leg. The fifth benefit is now Jenty has been getting more and more neck control. The sixth benefit is Jenty has been inhaling and exhaling deep breaths from his lungs. His breathing pattern has become good like normal. The seventh benefit is now there is no bad sore in the body of Jenty because he exercises more and sleeps less due to 6 to 7 hours Vasa concept activities. The eighth benefit is the blood pressure, heart rate, respiratory rate, and SpO2, means level of oxygen in the blood, are being normal now. And also with the 6 to 7 hours of exercise, the skin of Jenty is more healthy and shiny than before. The ninth benefit is earlier the blood and urine test of Jenty were carried out 3 times in a month due to the infection. But now there is no infection of any kind. So no need to conduct any blood tests. Presently, there is no blood loss from the body of the Jenty bhai. Even though Jenty bhai is in comatose condition, our family members go around him and talk to him in a positive manner. Perhaps he is listening to us. We maintain happy and cheerful environment around the Jenty bhai so that we can feel our feelings. So Jenty bhai can feel our feelings on his own. Dr. Vasa madam takes a weekly report of every patient and monitor the progress report of the patient and gives her guidance. In today's era of Kali Yuga, 60% of doctors think about their fees first. Even after charging huge fees, they don't know how they can do well to his patients. On the other hand, look at Dr. Vasa madam. She uses her own source of income to treat the helpless patient and his family. And she always ready to help selflessly. I would like to tell all of you that we have experienced journey of Jenty bhai's recovery. And we proudly say that Vasa concept science is the best. There is no alternative of Vasa concept in today's time. Dr. Vasa madam is like an angel for comatose patient like Jenty bhai, and she is also angel for CP child patient and patient of paralysis. Apart from the hard work of our family towards our patient, there is no any expense in this treatment. Seeing the selfless devotion of Dr. Vasa madam, God has to make our patient healthy. Dr. Vasa madam provides her same spirit of service to every patient in the world. Dr. Vasa madam dedicates her life doing good to her patients instead of being dependent on so-called expert doctors. Dr. Vasa madam has empowered so many patients and their families. Thank you very much. Thank you. Over to Neeraj sir.
Fantastic, sir. It was quite inspiring, and we wish him a very quick recovery. We really appreciate that the way he's recovering and your efforts, your family efforts. We really appreciate that, and because of the wonderful efforts you all are putting and madam's guidance, your brother is coming out. Mr. Jenty bhai is coming out from the trouble. May God give him new life very soon, and he be independent very soon. We pray for that. Thank you so much, sir, for your valuable time and your comments. We really appreciate that. Yeah, Milind bhai, you want to tell something?
Now, we heard 3 case studies in detail. Now, what we have is a few videos which won't have any story, but this is like just to see the results of Vasa concept activities. Basically, it will show before what was the status of the any patient, stroke patient. We'll say stroke patients first, and then afterwards, pretty short videos, so you will not get bored. If we can do that, Dr. Neeraj.
Yes, please, sir.
Okay. So, Parth, you can start with Bharat Bhai and then pause just when in the initial stages. Bharat Shah, full screen if you can do. No, that the video is gone. Yes. Give us a minute. We are technician fixing the video issue. Okay, great. Okay, can you pause here? Okay. So here is a patient, young guy, maybe 40s or 50s, but he got a stroke at that age. But he was very lucky. His sister knew Dr. Rajul Vasa madam, so he was brought from the hospital straight to Dr. Vasa madam. And if you can see here, just after, maybe a few weeks after discharge, he's not able to get up in 2009, and then you watch what happens in a year or so. Okay, let's play. Not able to get up on his own, and in a year is live and kicking. Another year is back to work. So I believe that if the patient doesn't spend much time before they come to Vasa concept, recovery is really phenomenally fast. Parth, let's go to Harish Gohil, please. We will see a different aspect in Harish Gohil. So the sound is probably not coming. Parth, is there any way you can get sound in this? So I will keep quiet. Okay, we're not getting sound. Okay, Parth, let's play this tomorrow with the sound on. The most interesting part, we will not be able to see in this without sound. Okay, so let's go to the next stroke video. Mahesh, Bhai, or whoever is there. Kai. If we can play back with the sound, Harish Gohil. Okay, good, Mahesh. Another stroke patient is not able to walk by himself. Right seems to be affected. You can see the hand. Now, within 7 months, the hand has come down. He doesn't need anybody support to walk, and is picking up his own plate. Can you try Harish Gohil with audio? Okay. So here's a young girl. This is an old 2006 case. Before Vasa concert, she had to wear splints, otherwise she wouldn't be able to climb up or down. Now see, after 6 months, she's dancing on a fast music. We didn't have that music, but you can see her movements of the feet also, which was in splint just 6 months back. This is back around 2006-07, and she kept improving, and she's doing very well now. She's got married recently. Parth, have you run out of the videos? We had some more videos. Dr. Niraj?
Yes.
There are some more videos, but if he is able to play, otherwise, if you want to take questions, checking if there are any questions for.
Yeah, viewers, if you are having any question related to the presentation today, you can ask in the chat group. Regarding the medical questions, we will learn from the Mary on 8th and 9th how this Vasa concept works, what they are doing for the patient management, and all the know-how about the concept that we will learn from her on 8th and 9th. If you are having any question regarding the presentation done by the patients and their relatives, you can ask in the chat group.
Okay. In the meantime, we will play the videos. So here's a TBI case, that is traumatic brain injury. He's also become fit after Rasa concept. Not able to get up on his own. Maintain balance. Abhijit, are you there?
I'm on, Milind. So, shall we start the CP cases in tomorrow's session only?
Yeah, we can.
Let's check with Neeraj. If he got any question from the audience.
Yeah, there are a few questions I see in the chat group. One question is that, just a minute. Does Vasa concept involves only physiotherapist or a whole medical team? Anisha Singh is asking.
We'll leave that for Murray, but there is. I can tell you one thing: there is no big medical team. There is no medical team, that I can tell you.
Charmi is asking, the patient was treated with Vasa concept during his coma condition only, or after he was conscious?
He's asking about the last case study, is it?
Yeah, Charmi is asking about, yes, last case study.
So last case study, the patient was in coma with a lot of
condition.
Yeah. So patient was in coma with a lot of issues with heart, lungs, and other complications in the hips. Patient is still in coma, but the exercise or activities are being done while he's still in coma, as we saw in some of the pictures. But we are seeing that many, like he said, all the benefits, all the medical parameters have improved, and his skin and his responding to bells, noise or smell. So there are many other improvements.
Yeah, fine. So this question I will answer. Pooja is telling that eager to learn the Vasa concept practically and use it for the patients. Is there a practical course, and can we do practice under Dr. Vasa for learning this concept thoroughly? Yes, Pooja, it's quite possible. We are trying very hard to line up with Dr. Vasa to arrange the proper workshop kind of things for the learning process of the entire concept, because her aim is to give what she has achieved as a knowledge, and she wants to spread that knowledge. Actually, she believes that this is a God's gift and it should be spreaded to the entire community. So she's definitely, Dr. Vasa is willing to spread this concept, and she wants to that therapist and they learn thoroughly this concept. So if we are having good number of people with us, then definitely we will request her to arrange a workshop kind of thing. So Spinex Global can be the mediator in between to organize such things with Dr. Vasa. So if too many people are interested in arranging the workshop post-COVID situation, then definitely we can plan it out with her and her team. Yes. Sir, one question is this applicable for peripheral nerve injuries? I think UV, you should ask this question. You just note it down. You ask this question to Mari. That will be better. She will explain it better, being a medical practitioner. Again, Ayushi is asking that is it only for neuro patients? Again, Ayushi, I would like to tell you that you ask this question to Mari only. That will be, she will be able to explain this question answer in much better manner. Arif is asking that his Vasa concept is important for any kind of neuro rehab. Yes, Arif, I think it is extraordinary concept for any kind of neuro rehabilitation program. But you can ask Mari regarding the same. And sir, if you want to give any highlight, Milind sir.
No, I can answer the previous question. I think previous question was, is it only for neuro? So from what I've seen, it is in the neuro field. So non-neuro I have not seen for Vasa concept.
Yeah. Prasang is telling that we eagerly waiting for training. Definitely, Prasang, even we are eager to learn about this concept in depth. So we are also eager. Is Vasa concept is used in any kind of neuro patient? Yeah, I think this answer has been given and about the peripheral nerve injury. Milind, Malik bhai, I would like to tell you that you ask this question to Mari. She will be able to answer this question in much better manner. Yes, Vinci is telling if the team planning to arrange a workshop, please inform us, sir. Surely we will attend. Sure, Vinci and all others who are willing to attend the workshop, we will definitely let you know. I would like to inform all the participants a very good news that we are coming up with a organization, club kind of thing for upliftment of the physio of entire globe. So you can enroll yourself. We will distribute the necessary information in a week of time with all of you. That is right now absolutely free of cost. So any physio can join, or a medical professional can join that. It is the purpose of this group will be to uplift our profession to the best possible level. So it will be free initially. So we will include you and others, all of them who are interested into that group. So we will be able to easily organize the things and share among the group. Bhushan Patni is asking, is the Vasa concept also helpful for muscular dystrophy patients? Yes, Bhushan, muscular dystrophy can be definitely helped by the Vasa concept, that's for sure. And you can ask this question again to Mari for more physio related or medical related answer from her side. Dr. Tarpan sir is there. He's a principal of our physiotherapy college, Swaminarayan Physiotherapy College. He's attending. Sir, thank you so much for attending the workshop. We really, we are very happy to see you attending. Thank you so much, sir. You encourages us a lot. Charmi is asking that at present in which state this practice is going on. Sir, please, Milind sir, you answer.
So at this time, Dr. Vasa madam has visited many states. In terms of centers, there is a center in Nashik which has been running since at least 5 years, and there have been workshops in Mumbai. There have been workshops in Pune. There has been she has visited Banaras, Varanasi. She has visited US, and she visits Europe, that is Finland, every year. So there are workshops going on in there. So this is a kind of concept where a workshop is something that is a great starting point rather than a center.
How many hours of hours a day the therapy needs to be given? Sir, please give the answer.
Yes, this is a good question. So Dr. Vasa madam has said that time and again explained that expectation is 6 to 8 hours. Initially patients may not be able to do all that, but they'll start with 2 hours. Then we'll help them. They may need some, kneecap or some kind of protective equipment initially. But as they start enjoying or seeing the benefit, you will see that patients themselves want to do more and more hours of exercise because they see the results, they enjoy the results. So if it is kids, then the parents have to put on music and make them enjoy. So it depends on how the family manages, but the more the number of hours, the faster the benefits. So who will not want to do more hours if there is fast benefit? It's a question.
Yes, very true. Yesha Shah is asking, is this video available after live session? Yes, Yesha, it will be available on the same channel. You can use the same link to access the video at any given time. It will be on the channel forever. And if you want to see more testimonial videos, you can visit Dr. Rajul Vasa Foundation YouTube channel. And there you can find many videos for inspirational videos related to the Dr. Rajul Vasa Foundation treatment and the patients benefited out of the treatment. Jayshree is asking, can we use for old stroke patients like 3 years back? Yes, Jayshree, this is a fantastic treatment option. You can treat at any given time. Means the chronicity is not the bar as far as this treatment is concerned. I have seen patients benefited who had 15 years old stroke involvement. And ma'am and Milind sir might have seen even more chronic patients. So I personally feel chronicity is not the bar as far as Vasa concept and the benefit, its benefit is concerned in the neuro rehab.
That's correct.
Again, what is the duration what is the duration which this concept can be started? I think he wants to ask when we can start this concept on the patient. I think so. That's what this therapist wants to ask. If this is the question, then the answer is from very first day you can start to a patient, because it is it is associated with the developmental sequence of our neurological system. So whenever there is involvement, you notice the neurological involvement is there, immediately you can start this. But still, if this is the question, I think you should ask to Mari also. She might give you better answer. Nabhaya Singh is asking about 15 years old hemiplegia. Yes, just we answered about the chronicity of the problem. You can definitely give 15 years or even more than that. The chronicity is not again the bar for this concept. You can definitely get benefit out of this concept.
Yeah, we've had cerebral palsy children, ranging from young to 15 to 18 to 20, very rarely even 30 years old. So it can be considered started.
Yeah, Pooja, we will definitely let you know whenever we arrange the course on workshop specifically on the Vasa concept. We will definitely let you know. I request you all to attend all 4 modules of this Vasa concept. It is very well thought. We have put a lot of efforts to design this entire 4 days of the program, including Dr. Rajul Vasa and the entire RVF team. So we have done a lot of efforts to make a point that you get the best out of it. So please make it a point that you learn all 4 modules thoroughly.
I just want to add something. There's a question about center and there's a question about duration. So that reminded me that we had before this corona, of course, we had a center in Solapur which might restart, and there we have seen that if the younger kids are brought in early, the results are really phenomenal. So I mean, the need of the hour is to take Vasa concept to as many people as possible, so that patients don't have to wait for years and years, because the more years they wait, you know better than me that then the recovery takes even longer time. So that is the need of the hour, to take knowledge about Vasa concept quickly out to the
Absolutely.
society.
That's extremely important. Being a physiotherapist, I must tell you all that this is extremely important. As early as you start this concept in the neuro rehab, you are avoiding so many complications in the patients, and directly you can start getting good recovery. Pradeep is asking, Vasa concept is different from Bobath and Brunstorm concept. Yes, definitely it is extremely different, and it is an innovation. It is entirely the new science, what Madam has explored. This is not at all based on any established neuro rehabilitation science so far, Pradeep. So it is absolutely a new concept, and it is extremely helpful concept. Where can we enroll? We will definitely give you the information whenever we are ready with it. What is the best stage of recovery the concept can be used? Again, means this is actually the same answer. You early is the best is the answer for this. Seen as how much old case of stroke patient can benefit from Vasa concept. Again, Sahin, it is again the same question. Age is not the bar, and the chronicity of the problem is not the bar. So after how many years are gone, that doesn't matter to implement this concept.
One thing I can add is my wife's case itself was, she had spent 13 years before joining Vasa concept. So quite a chronic patient. Her age right now is about 48. So she's able to do exercise, all the activities. So as long as the patient is not very too old, I think the chronicity can be somehow dealt with.
Yes. Malik, how can you inform us about any workshop or any course on Vasa? Malik, you can join our WhatsApp group. So I will share in the scroll about the phone number. So you can ask your query. I will send you the link for joining the group, and you join the group. You will get all the information of forthcoming programs. How about rehabilitation with dystonic patients? In dystonic patient, Raji, this is extremely effective program. You can be helpful a lot with dystonic patients with this concept. Sir, Milind sir, if you want to tell something about it.
No, yeah, I've heard the same thing. So there's no problem with that. Dystonic, it can be treated.
Manikandani, how much duration this technique will take for minimum visual recovery? You see, Manikandani, as you all know that all neuro conditions are different, and recovery pattern is extremely subjective. But I can tell you that by applying this concept, you can expect very quick recovery and very quick results, that's for sure. And even reversal of so many complications which you cannot avoid in most of the neurological patients recovery with the traditional programs. So that's what I can tell you. but this is extremely subjective to give any kind of timeline as far as the speed of neurological rehabilitation is concerned. Yes, Parkinson's, in Parkinsonism, this is extremely useful treatment you can use in Parkinson's patients as well.
Or we can ask Marie.
Yes. Sanjay is asking how to decide when child should start standing for CP child. I think Sanjay, you asked to Mari. That will be better. This question, she will be able to explain the answer in much better manner.
It's a good question. We'll leave it for the expert.
It's the workshop available for international medical staff. Yes, it will be available for international medical staff. Whatsoever workshops we are going to organize with Rajul ma'am and other speakers as well, that will be open for the entire humanity. So anyone in medical profession can join us. I think, sir, we are done with the questions. Thank you very much, viewers, for joining us. We really appreciate your enthusiasm. Thank you very much, the relatives and the patients, Suresh bhai, Abhijit, Sheetal, Milind sir, everyone. We really appreciate your enthusiasm and the way you all have presented the condition. It is quite inspirational to all of us, and that will definitely be helpful to change the direction of the neuro rehab. I am very sure for that. Thanks all the viewers for joining us with so much enthusiasm. It is almost 2 hours and more than 2 hours now, and still you people are with us. That is really commendable, and we really appreciate that. Thank you so much, everyone, for joining us. We are expecting you all to come again tomorrow. Also, we will be witnessing the CP child cases, the pediatric cases tomorrow, and we will take, we will see how they are recovering and they are getting benefit out of the Vasa concept. Thank you so much, everyone. Thank you, and thanks to Dr. Rajul Vasa ma'am, Vivek sir, and the entire RVF team for organizing and for supporting us to organize this. We really appreciate, and ma'am, we salute you and your humanity and your kindness and the way you have develop this concept, and still you are so much willing to spread it, to give benefits to the patients and to give this knowledge to the therapist and the professionals. That is phenomenal. Without any expectation, what you are doing is really commendable. We really salute you. Thank you so much, everyone. Thanks a lot. Thank you very much. Thank you, Parth. Thanks, everyone. See you tomorrow.